Hey everyone, Holly Watkins with the ARC of North Carolina, and welcome to our podcast Around the Table, where we focus on issues that are important to people with intellectual and developmental disabilities and their families. I am super excited to have our guest today, Kelly Crosby. Kelly is, and she's got a bit of a long title, and I want to make sure I get this right. Kelly is the director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services at the North Carolina Department of Health and Human Services. That is quite the mouthful.
It is.
So let's go ahead and just jump right in. So Kelly, you've been in your role for about 18 months now, so you're kind of new-ish. I know that several folks in the community know you, but we have other folks that may not know you. So can we talk a little bit about your background?
Absolutely. And Holly, I'm so excited to be here today. Thank you so much for asking me. So as Holly said, my name is Kelly Crosby, and I am new to the Division of Mental Health, Developmental Disabilities, and Substance Use Services, but not to the department. I've been to the department for about 13 and a half years now. And many of you know me because I worked at the state Medicaid agency for a long time. But while I was at Medicaid and here in my whole life, I have worked in the mental health, substance use, and IDD fields my whole life. And so some of my earliest memories are, I had the real privilege of being raised in a town where kind of community engagement was just important to my family and who I was. And I had very early on experience working with folks and having friends with intellectual and developmental disabilities. We would do community service together, and we all knew there were some gentlemen that we were all friends with, and they actually lived in, I didn't know this until I was older, they all lived in an IDD group home in my community, but, they were part of our community as well. And so I grew up and I went to school for social work. I was a social worker for many years, and I've had many hats. I've been a clinical social worker. I provided therapy for families and individuals and folks with both mental health and IDD. But I've also worked in advocacy and in program development for large companies that supported people with intellectual developmental disabilities, from everything from inclusive employment to group home and independent housing. And so this has been my privilege to do this my whole life. And I'm very excited to be at the division. But my whole life I've worked with in this field, and I have family members with intellectual and developmental disabilities, and I'm a person with lived experience. Lots of individuals in my family with serious mental health and substance use issues. So to me, this work it's incredibly personal. And I am a social worker, and the best part of being a social worker is being an advocate. And I feel like at the state, I'm able to be the best advocate I can be.
Wonderful. So let's start with the first question. I want to talk a little bit about whole person health. So can we talk about why whole person health is important, especially for people with IDD?
Yeah, well, because we're whole people. And I'm so glad that, for years we've been talking about whole person health. And at the policy level at the state, we've been trying to do things that make sure that we're acknowledging that people are complex and beautiful, right? We have physical health needs, we have mental health needs, we're all one person, but we also have life needs, right? We've got social needs and housing needs, and we all eat, and we need to go to school and have vocations and things that we do for fun. So we're whole people. And so as we're moving in, like an obviously big thing that's happening now in our community, right, is we are, if you get public benefits, we're moving into tailored plans. And so that is a kind of a public policy way to make sure that the funding for all services that a person could get in Medicaid or even the state dollars, whether it's for medical services or pharmacy or mental health services or home and community-based services, are coming through one entity. So hopefully that's better, easier to coordinate for families. They only have to work with one kind of insurance company and one care manager or case manager that's helping them coordinate all their life needs. But it's kind of coming from that philosophy that we're whole people. And if we are getting services or supports, we shouldn't have to go to many places. We should be able to go to one place because we're whole people. we should be viewed as little people, and we should go to one place to get help for all of our needs.
Right, absolutely. So you touched on this a little bit, going into tailored plans and care management. These are two big services that are exceptionally important to people with IDD. And we know the tailored plan launch is happening July 1st. So can you talk a little bit more about tailored plans and care management specifically as it relates to people with IDD?
Yes. So tailored plans, if you have Medicaid or if you receive publicly funded services, non-Medicaid services for intellectual and developmental disabilities, you're going to be getting services from a tailored plan. And a tailored plan is your LME. So we all know who our LMEs are. They're Trillium, VIA, Partners, and Alliance. Sorry, I had a mind blank there. So they're LMEs we know and love, but we've also asked them to be responsible for physical healthcare and pharmacy, but also housing and food and other additional supports and services. So these are the LMEs you know and love and you've been working with for a long time in the public system. Tailored care management is a bit of a new service, and I'm a huge care management fan, right? I'm a social worker. I've done care management and case management for many years. And so everybody who's going into a tailored plan can have a care manager. And the care manager, I think, is such a wonderful asset because a care manager can help sit with you, your family, talk about what your needs are across the spectrum, right? Medical, mental health, community-based, food, housing, and help coordinate those services with healthcare providers or community-based providers, help you find housing support. So care management's really a wonderful, cool new service. It's new and it's been complicated to roll out. And I know a lot of families aren't even sure what it is or how to get involved. And I know we'll talk about later in the podcast about that, but we want to make sure that families know about the service and know how to access it.
Right, absolutely. So switching gears just a little bit, something else that we hear a lot from our families centers around workforce development.
Yes.
So can you talk about what's being done at the state level regarding employment, not only for people with IDD, but for our direct support professionals as well?
Yes. Direct support professionals are awesome and they are rock stars. And we have been working with a direct support professional advisory group here at the state. It's made of consumers and families and providers and LME staff about what can we do? How can we invest in strategies to grow, create a pipeline, create a direct support professional workforce, help providers recruit direct support professionals, help family recruit direct support professionals, help them stay and grow in their career. So we actually are publishing, we've sent it to the advisory group, but we'll be publishing our workforce strategy. And it talks about all the things we want to do in partnership with the community. And that's everything from just raising Medicaid reimbursement rates, right? Direct support professionals do wonderful, important work for our loved ones. They're critical in all of our lives. But direct support professionals in my life, they're critical, right? They should be honored and paid a good wage. So we're all on board with good wages. And in addition to that, we need to make sure that we are letting folks know that it's a career to be a direct support professional. So we're working with community colleges to make sure that there is a certification program. We are letting high school kids know this is a great career to go into. Here's a way to get certified. And here's a way you can get paid apprenticeships with employers. And here's how you can get continuing education and get things like raises and move through a career. So we're doing all of that in partnership with community colleges, with providers who would provide those job placements, with LME MCOs, right, around the wages and wage increases. So we've listened. We've listened to providers and direct support professionals about what we really need to do to make sure that we create and grow and maintain a solid workforce. And we're using some money that the General Assembly gave us to try some of these opportunities out with the eye towards the ones that seem to work and seem to really help to grow and maintain the workforce, continuing those. How can we continue those workforce initiatives?
So are there other programs at the department, at North Carolina Department of Health and Human Services, any that have been implemented to help people with IDD?
Yes, I mean, there's two things I want to mention. One is Inclusion Connects. So Inclusion Connects, we just launched it. It's a campaign. You can go to our website and Google Inclusion Connects. Inclusion Connects, it's just the beginning. But Inclusion Connects has three parts. The first part is getting folks into services. So I want to make sure that across the state, families, individuals with IDD understand that there are publicly available services through Medicaid and the state dollars. So I want to make sure people know about services and know how to get them, know how to get on an innovations wait list, know how to get care management, know how to get 1915I option services. So that's like part one, getting the word out and also making sure that we have provider capacity, which is pillar two, direct support professionals. We need an action plan to make sure that, and we need initiatives that make a difference in helping to grow and maintain a direct support professional workforce. So that's the second pillar of Inclusion Connects. And the third is housing. So what we also need to do is making sure that we're understanding the needs across our state for housing, and that's everything from independent housing through community ICFs. We need to understand what our needs are, what our needs are of all those folks on the waiting list, and where we have capacity and where we need to build capacity. We also need to know more about the types of services like supported living that are helping people maintain independent housing, like technology that are helping people maintain independent housing. So right now we're doing kind of a needs assessment of where we are and what people need, so we can develop an action plan for making sure we have a robust housing system for people with IDD. So that's Inclusion Connects. The other thing I want to mention is, and that's a long-term project, y'all. That's not something we're going to do overnight, but it's a commitment. It's saying we have a plan and we're going to keep chipping away in partnership with the community on these three things. Chipping away till we get them done. Part of supporting Inclusion Connects and just supporting our system overall is our accessible language campaign. So we heard really loud and clear, like when I first started this role, heard really loud and clear from consumers and families that our system is just too confusing. People didn't understand letters they were getting. They didn't know their rights. They didn't know how to access services. I go to communities to this day and people will say, what's innovation? And these are folks who could have been getting services or could have been on the wait list for years. So our accessible communications campaign is aimed at helping to explain our service delivery system in easy to understand terms. So the first part started about a month ago. The first part was explaining, what is this tailored plan thing? What's changing? If I have Medicaid, what's changing for me? What are the things I need to do by July? If I have questions, where do I go? Just some really simple things. So we have everything from the social media campaign to PowerPoint presentations. And we created this with community members. It doesn't matter what kind of communication I need. It matters what kind of communication the community needs. So that was part one. This is what we're working on now. I have in my inbox right now materials that were created with consumers around tailored care management, what it is and how do you get it. So I'm excited. After that, I-option services. What are they? What term, I-option services, what are they? What do they really need? And how do you get them? So we're very excited about just getting the word out in simple fashion so people know what's available, know how to advocate, and know how to access the services and supports they need. So we're super excited about our accessible language campaign.
Yeah, I find, again, what we hear a lot from families is, a lot of the materials they receive are confusing. What are all these different programs? What's an innovations waiver? What is a 1915I? What is an LME MCO? So there is a lot of information to understand. So a campaign like that and a plan, a communications tool, I think would be very helpful and useful. So looking forward to that.
Yeah, and Holly, props to the ARC. I've said this before, but I want to say it here. You guys are such leaders, like this podcast. We've learned a lot from you. We've learned a lot about how you advocate for the people you support, but also how you communicate. The materials you develop, the way you try to help folks understand the service delivery system. So just want to applaud you for what you are doing to help people understand the system and navigate it. And we're learning a lot from you. So I appreciate the work that you're doing in the community.
Oh, well, I appreciate that shout out. And we appreciate the work that you're doing as well. And I think that's a great place for us to end. So I want to thank you, Kelly Crosby. Thank you for being my guest. So appreciate you being here on Around the Table. So for folks, keep coming back. Come to our YouTube channel for our latest videos. Scan the QR code that you see at the bottom corner of the screen and visit our website. Thanks, everyone.